Auzubillahiminash-shaytanir-rajeem. Bismillahir-rahmanir-rahim. I hope you people are fine. Today, the topic we will be discussing is specifically for medical students learning eye, and the topic which we have chosen today is retinitis pigmentosa. First of all, it is a misnomer. It is not an infection or inflammation. By you people, don't be deceived by the word retinitis. And it is a disease in which the younger population is usually involved, but any age can be involved. Usual age of presentation is in can be anywhere between 15 to 30 years of age, and the patient typically complains that he cannot see when after the sunset. That is night blindness is the main complaint, and it is a very unfortunate disease. It has as far as its etiology is concerned, it runs in the family and it has got genetical predisposition, both autosomal dominant, autosomal recessive, and X-linked recessive, and it can also occur sporadically without any genetic predisposition. The main pathogenesis in this disease is the degeneration of the photoreceptors of the eye, and the photoreceptors first which are involved are the rods. As we know, there are two types of photoreceptors. One are the rods, which are responsible for our night vision, and the other are cones, which are responsible for our day vision, light vision. So rods are present anatomically in the periphery of the retina, and the cones are present in the central part of the retina. So it affects the rods first, so the patient presents with the complaints of night blindness in the beginning. It is a very slow disease, but depends from patient to patient. It is a progressive disease, and later on the night vision becomes more troublesome, and the patient may be having no symptoms in the day, and he could be 6 by 6, and later on, if the disease progresses, it also starts involving the cones, and then the patient's day vision is also involved, and patient does not remain 6 by 6. The triad of retinitis pigmentosa, to remember that there are three typical signs which you will see on fundoscopy. Number one, there will be pale waxy disc. Number two, there will be attenuation of the retinal arterioles. Number three, you will find the bony spicules at the periphery of the retina. It is a triad of retinitis pigmentosa, and diagnostic signs. Unfortunately, it is very unfortunate for anyone to have any disease, and a disease like this, and the treatment options are very limited and mostly aimed at low vision aids. If the patient can see without glasses. Till then we can wait, and if the VN decreases and the rods are also involved, then we ask him to go to some low VN aid clinic and take the help of different modalities of low VN aids. There is no so far you can say the perfect treatment for the disease as present for the cataract. So I will it is one of the causes of night blindness. Other most important other not most important, but one of the important causes is vitamin A deficiency, which is not very common, and this is also not very common, but still it is present. So I will stop here and hope to see you in the next video. Please in the comments box write down what you people want to listen about, and here I will say Allah Hafiz to you, and जिंदगी रही तो इंशाल्लाह फिर मिलेंगे. खुदा हाफिज.